Elland Road, the home of Leeds United. Before COVID, 35,000 used to pack the stands every weekend. Now that's the number of people being infected with the virus in England every day. That's the conclusion of the Office for National Statistics, which randomly tests tens of thousands of people every week, whether or not they've got symptoms. Of all the stats we get, these are the ones to pay attention to. Across England, 433,000 people had the virus last week. That's up from 336,000 the week before. And it works out at 1 in every 130 people being infected. But there are big regional variations. In the southwest, it's about 1 in 300. In the northwest, it's 1 in 59. That's one person on every busload. Other data suggests the official R number is down marginally on last week to somewhere between 1.2 and 1.4, suggesting the epidemic is still increasing, but a little more slowly. One senior scientist warns more restrictions will be needed to reverse the rise.
Tier 1 is probably not sufficient to control the epidemic. I suspect that many areas that are currently in Tier 1 will at least move into Tier 2 over the coming weeks.
Our analysis of other stats suggests that students may be masking a background epidemic in some cities. This is Manchester, divided as the whole country is into small areas, each with just a few thousand people in them. We identified where the university halls of residence were and then tracked the second wave. Now, to start with, all parts of the city saw a gentle rise in cases, but when the students arrived, the infection rate in university areas exploded. Then, as thousands isolated in their flats, cases fell almost as fast. But meanwhile, cases in non-student areas are still steadily increasing. It's a similar picture in Sheffield and Liverpool and Nottingham to a lesser extent. And that's a worry. Non-student areas have an older population with an increased risk of serious disease. That suggests there is little hope of admissions to hospital easing in the next few weeks. If the number of new cases doesn't start falling soon, there'll be increasing pressure to take even stricter measures to control the virus. Thomas Moore, Sky News.